UPB Dental Academy. This is Dentistry In-Depth and Interactive. No PPE required because the CDHO isn't here governing the conversation. We are in our typical post-COVID hoodies and gym pants. But the biggest topic right now, and the one I think that's troubling us the most, and dentists especially, and the industry of dentistry, is how do we get back to normal when we're in a battle with the colleges, I guess you would call it. You've got
like a pissing match.
A pissing match. You've got 52 states that are back to work. You've got 99% of the country of Canada back to work, except one province, because there's a sticking point. I sympathize with it to some degree, but it also has pushed it to the limit where now I'm actually supporting hygienists, worried about them for their jobs and their future, because a college that can't manage to get on board with the rest of the country and the rest of North America. We're finally coming out of this pandemic, and the biggest challenge now is how do we get back to work and how do we become successful again when we've got two colleges that are battling. We have the Ministry of Health in Ontario that is suggesting we're good to go. We've got the Royal College of Dentistry ready to go. We want protection, we want safety, we want to provide the best dental care and the best healthy atmosphere, and yet we're sort of at loggerheads, we're butting heads with the CDHO. We're not having an issue with hygienists. We are just at a stalemate with their college.
Well, I mean, this has created a conflict between hygienists and dentists, and it's created conflict within the office. So nobody really is blaming each other, but that's where it's going, right? So you've got the CDHO saying you need full PPE, the RCDS saying you don't, and the reality is that who pays for the PPE? The dentist. So the dentist is like, let's get back to work with the new rules with the RCDS. This has created a massive conflict between the owner dentist and the hygienist. And the problem is that a lot of dentists are frustrated with how long it's taking and all the shit show that it's creating between the decision makers in CDHO and how it will impact the practice. So the other thing is that a lot of dentists are saying, well, if you guys can't come back to work without PPE or without the full PPE, then technically we could just hire a new grad who is a dentist who will fall under the RCDS rules and literally use new dentists, give them jobs, and avoid the whole issue of, spending $46 per person per patient. That's the biggest problem. And then how do you mitigate the cost of it?
Well, yeah, and let's not get too far ahead of ourselves, because the thing was, when this first started to evolve and dentistry was told that they were going to have to be at a higher level of PPE, nobody debated the cost at that time. And dentists were prepared to do whatever it took to come back to work. If it meant putting up walls, barriers, full PPE, investing in air filtration, whatever it took, they were willing to do that. It's not dentists per se that are coming back and saying, I'm not willing to do it. As the regulations change, the dental professional has flowed with the change, and is willing to come back. And then we're actually butting our heads with the hygiene college, who's not at that point. And it's only in Ontario.
But the problem is that it's actually, you said something that I actually don't agree with. I don't think we were okay with implementing all the changes. We were
not okay, but you would have done it.
We were doing it, and I'm doing it, and we were all doing it. But the reality is we were trying to figure out how to deal with the cost of all of it. So here I was putting in doors, renovating my office, putting air purifiers in, trying to order unavailable N95s and gowns and shields. And all that stuff was coming at a tremendous cost, but it was my responsibility to figure out how to deal with the cost of it. But now it's a weird dilemma that this situation created, is now I don't have to figure it out. Who does? It's the CDHO made it impossible for hygienists to come back to work without figuring out how to pay for the PPE, because it's no longer my responsibility in a way.
Exactly.
I mean, to be the devil's advocate, of course it is in some way, if I want my team to come back. But the question is, can I shift my office? Can I change my office to change the numbers of people coming back? How do I manage the cost of it without me losing it, because everyone's looking to us, like the dentist, to lose it. And I'm tired, and I mean, as anybody who watches the show knows, I am sick and tired of the dentist being blamed for everything that's out there, including cancer. So, you know, now we finally, this has allowed us to step back and go, wait a second, now we don't have to do this. We can pass the buck to someone else to make the decision. So, hey, CDHO, you said everybody needs PPE. Go find us some.
Yeah, well, and go find us some and finance it if that's the case, because right now, and it's very unfortunate, we started the whole movement, the hashtag support RDH, is we are behind the hygienists. We want them to come back. We want them to perform. And it's in a holding pattern, and we're being put in a stranglehold by a governing body that's the only one in North America that doesn't seem to see fit to go back to work.
So devil's advocate again, right? So let's say the CDHO is right. Let's say we should all be in full PPE. Let's say we should all be completely protected. Maybe that is the new way of doing dentistry, and part of me actually feels like this is the right path to go. The question is, what do you do when my costs, I don't know about other people, maybe DSOs have, you know, lower fees for this stuff because they're buying in bulk, but as a solo practitioner, the cost of PPE per person, per provider, per patient is $46 right now. So $46 per cleaning.
Yeah.
What happens there?
Multiply that out over and over.
Are the patients going to pay for it? Are you going to be able to call the patient and say, hey, patient, your cleaning is going to be, I don't know, $150, $200, $250, plus I'm going to add a $46 fee each time you come in because of PPE. Are they going to pay it?
Right. And that's where the challenge really starts. And the whole thing being, at the end of the day, we forget it's the ministry that's setting the guidelines. It's the Ministry of Health that tells us which direction we have to follow. When the Ministry of Health came out with a set of guidelines midway through COVID, the dentists not even reluctantly, but they agreed that this is the route we have to follow. And as those guidelines changed, dentistry is following that. I'm really, really stuck, and it's been a big challenge for me to understand how the other colleges aren't coming on board to support the industry, where we just got a survey back from the ODA?
Yeah, the ODA.
That 45% of the people surveyed said that if we continue on this route and don't get back to practicing and scalability of our clinics, 45% of those dentists said they may have to close their office by the end of the summer if this continues. So that's a staggering, frightening number. And if we think that we're putting hygiene and dental employee into risk, can you imagine if that much of the industry just disappears?
You know, no, and I mean, like, those numbers are staggering, and they're based on a survey that even I filled out recently, and it does come down to the fact that, can we carry our businesses at a loss, and for how long? And nobody can. I mean, you can't function like this, constantly losing money you can't bleed money out and think you're going to stay in business. And so everyone's looking to us to pay for everything and to bring everybody back full time, and it's like we can't. And the reality is that people will lose their jobs. Hygienists will lose their jobs because none of us can bring everybody back full time with the escalating costs of everything that's going on.
Yeah.
But here's another problem. So here's the other issue. So the hygienist is required to wear N95s, eye protection, shield, gown, change your gloves 1,000 times. So now, what happens when the patient comes in for their cleaning and sees that, but then they come in for restorative and doesn't see that? So now the perception is the hygienist is safe or protecting their safety or whatever, and now the dentist isn't. So now the pressure is on for all of us in the office, because you have to be standardized. You can't have one person wearing PPE and the other person not, especially when there's more aerosol technically produced in drilling and mercury removal and all this other stuff. So now it enforces us to follow the CDHO rules and incur even greater costs running a practice. So now what happens to the practices? I mean, like in my practice, we don't take insurance and we don't take assignment, but what happens to the practice that does? That they're used to having patients walk in, walk out, no payment, and now you're incurring 46 times 2 when you have you and your assistant plus the hygienist times 17,000 patients that you see a day. Things are going to change.
Right. And I don't want to make this all about money, because at the end of the day, that's the bottom line. And the CDHO is basing this on where's the science. Well, again, my biggest question is, if the science has been proven over and over, province to province to province, state to state to state, and the government and the regulatory bodies in the government and the Ministry of Health are saying these are the guidelines that you need to follow. This is the same ministry and the same government that told us we can't go back to work is now giving us the green light to go back to work. Dentists are not balking at the fact that we want to keep you safe. It's the number one criteria in a dental office to make it safe for the patient.
It always has been
to make it safe for the team. It's safer than the hospital. It always has, and it always will be. So we're not balking at that, and we're not making this all about cost. We're making this about how realistic is this to carry on at the rate that they're going.
But it's funny. Anytime somebody says, you can't just focus on money, my comeback would be that without money, you can't focus on anything. If I don't have money to build a business, I have no business.
Right.
If I don't have money to buy PPE, we have no PPE. So the reality is that you can talk all you want in your idealistic ways about money, but without money, you have nothing.
But we're not putting money ahead of safety. We're all about
but you
safety.
still have to have the money to create the safety.
Right.
So if you don't have money, you can't make the safety. We can't have safety without money. So it's like the chicken or the egg. What came first? Money comes first. If you don't have it, you can't create safety. So where's the money going to come from?
Right.
That's the bottom line.
Right. And I don't see these CDHO writing any checks to pay for PPE right now. I know they're writing checks to pay their own paycheck, but they're not writing checks to support the industry. And it's very frustrating when I get hundreds of messages a day from hygienists, even frustrated with their own governing body on how do we fight this. We want to come back to work. We want to be compliant with the dental college. Let me ask you this as a dentist. Does the future hold a one world governing body in dentistry eventually? But to me, as a lay person who doesn't speak to any of these colleges, would it not make sense to have we have one federal government. Would it not make sense to have one governing body in dentistry that covered everyone? Hygienists, assistants, dentists. I've got assistants losing their mind because they're caught right in the middle with no governing body, and a weak association.
You know what? I don't have the magic ball. I don't know what the future holds, and I'm not a politician, so I don't know how government works and how different governing bodies come together and unite, because we're literally in the middle of the worst divorce ever when it comes to the CDHO and the RCDS. But the reality is that we, as dentists, have to make this work, and we have to find a new future for our business. So there's a few things that I am shocked at that I'm not seeing. I'm not seeing the CDHO and the RCDS and the ODA coming together to go towards the public and the insurance companies and say, hey people, you guys need to understand that there's a cost to PPE, and dentists have had to make a ton of changes, and you will have to pay for that. If you're not paying for it, there's something wrong with that office. Yeah. Send the message that if the office is not raising their fees, there's something wrong there. Support us in allowing the cost changes to happen, so that if an office is afraid to do it, they'll actually be shunned. Help us make it easy to raise the fees to accommodate for that, and then everybody wins. Because the reality is, if I'm supported by my association, by my government, by the public to raise my fees to accommodate for that, then there is no fear in doing it. There's no fear in bringing my hygienist back and protecting all of us and the public and the staff in order to make this right. The truth is that I actually will be implementing full PPE across the board in my office. Now, the cost is not going to come from me. It's not going to come from my daughter's future. It's not going to come from, the food I put on the table. It's going to have to come from the patient. So the reality is, how do you do that? Do you cut wages? You're not going to have very happy people if you cut wages. So what are the answers? So you guys have to come together as an office and say, what are the solutions for us? I know what my solutions will be. They may be different for your office, but whether it's increasing your fees by 10%, or maybe creating a PPE fee that covers the cost. I don't know what the solution is for your office, but there are many solutions that unite you together to cover the costs that don't include the dentist constantly paying for everything that has to change.
Yeah, I think you hit the nail on the head. At the end of the day, all these entities have to come together to work towards a common goal, and right now it is really just it's a he said she said, and it's a pissing match, and right now that's not serving anybody. So I implore people from the CDHO, Lisa Taylor, whoever you are, come out and sit and have this conversation with us, because we're willing to create that olive branch and bridge that gap, because it is necessary for the success of the business of dentistry. It's necessary for the success of hygienists moving forward, because we're already hearing where doctors are hiring, like you said, new grads and associates to do the cleanings, because they're probably the ones who've been taught it at the last part of their.
Well, a good friend of mine
college.
just called me yesterday and said her husband just fired all of his hygienists and hired new grads because he's sick and tired of dealing with the fighting, and that's what this is causing. So I feel like what should have happened, and I mean, I got the message from the CDHO saying, we stand by our decision, but that's all you guys said. Like, it should have been more. It should have been said, we stand by our decision because, and here's what we're willing to do to support our hygiene community to move forward, and really work towards supporting the hygienist, supporting the dentist, and moving forward. There's nothing being done with that decision. It's just like, we stand by the decision. And then what? And then these poor people are going to be out of jobs because nobody knows how to mitigate the cost of the PPE that's being enforced.
And I watched the CDHO council meeting, and they just spoke in circles, and there was really no resolution to it. And we want to come to a resolution. It's not that I have anything against any of the governing bodies. I would like to be, and us to be, a conduit to bring this together so that we can move this thing forward, because I don't want to see half of dentistry extinct, hundreds of hygiene jobs go by the wayside, because that's what's going to happen. The government is allowing wages to be dropped to protect businesses and allow them to stay alive because of COVID. So that's going to be a factor. Not for long. And how long will they be around? Or hygienists are going to be replaced by new grads, or people are going to scale down their practice size and scale up their practice treatment plans from the dental side. So,
and that's what I'm doing.
Yeah, and that's what you're doing right now. It's up to us if we want this thing to survive, to be profitable in the future, to be a great dental community. We got to come together. So we're imploring you. How do we do that? Reach out to us. We want to make that happen. I'm Mark Gaylord. I'm with Dr. Agatha Biss, as always, UPB Dental Academy. This is dentistry, in-depth and interactive, in a really challenging time.
Awesome.